So for the new people, I am Dr. Chanda and I'll be taking your biochemistry practicals. Okay. So far, how many tests have you performed in your biochem lab? Yes. What test did you do for reducing sugar? What is the name? Benedict's test. Yes. So today we are going to learn about test for ketone bodies. That is for detecting the presence of ketone bodies in urine. Okay. Another abnormal constituents of urine. Okay. So in a normal urine there can be presence of ketone bodies approximately 20 milligram per 24 hours. That means if you examine a normal healthy person's urine sample, you can get approximately 20 milligram urine in 24 hours. Now what happens in case of starvation? Suppose you can say some people go starvation for puja. They do starving, or some people say that I am starving for Bhukh Hartal. I am doing that. Now, how can you say that? How can you find out that is the person lying or are they actually doing it? That is by the testing the presence of ketone bodies in urine. Because what is ketone? It is a byproduct of fat metabolism. So what happens during starvation? You are not eating anything, right? So but your body requires energy for working. So the stored fat from our body is getting metabolized, and as a byproduct we are having ketone bodies in the body and as well as in the urine. Okay, now what happens? We have limited supply of oxygen in our body. So all the ketone bodies, that is the acetoacetone, that will not be decarboxylated. There are excess amount of acetoacetone in the body because of the fat metabolism. So that a portion of the acetoacetate will get decarboxylated. Okay, portion will get decarboxylated and the remaining portion will be circulating in the blood as acetone or beta hydroxybutyrate. Am I clear? Did you understand how ketone bodies are formed in the body? It is a byproduct of fat metabolism. Okay, so when you're starving, or suppose let's say in a case of uncontrolled diabetes mellitus patient. What is uncontrolled diabetes mellitus? Means the sugar levels are not staying in controls. And suppose the patient is also not taking the insulin properly. He or she is not taking the insulin. So if the diabetic patient is taking food, will the food get digested? Without insulin it won't. But the patient also needs energy to function. So then the patient's stored fat of the body will get metabolized. And as a result of the fat metabolism, ketone bodies will be formed. Now excess ketone bodies, that is the acetoacetone, which is a ketone body, all of it will not be decarboxylated because we have limited amount of oxygen supply in our tissues, right? So the portion will be decarboxylated, that will form acetone, and the rest of it will form the rest of it will be circulating in our blood. In our body it will be circulating in our blood as beta hydroxybutyrate and acetoacetate, and then the same thing is written over here. Okay, so there are two tests that we do to find the ketone bodies, presence of ketone bodies in urine. The first is Rothera's test, the one that you will be performing today in the lab, and the other test is Gerhardt's test. And there are three types of ketone bodies, that is acetone, acetoacetate and beta hydroxybutyrate. Okay, so Gerhardt's test you will not be performing in the lab. We will only be doing the Rothera's test, but you have to know about Gerhardt's test, because if you during your practical exam, if you get ketone bodies, if your urine is positive for ketone bodies, the teacher might ask you about Gerhardt's also. So you can't be blank, you have to know about Gerhardt's as well. So the thing about Gerhardt's is, in Gerhardt's test we take around 3 to 5 ml of urine sample. We take 3 to 5 ml of urine sample. To that we add 10% ferric chloride. Okay, and that changes the color to Bordeaux's red color. And after that, if we boil it for 5 minutes, If the color disappears, that is the presence of acetoacetic acid. That means the presence of acetoacetic acid in the urine sample that we took. And if the color persists, that means absence of acetoacetic acid and presence of salicylates. So this is what Gerhardt test is about. But there is a drawback why we don't perform this test is there are three types of ketone bodies, right? Acetone, acetoacetate and beta hydroxybutyrate. But doing this test we can only find about the presence of acetoacetic acid, right? We cannot find the presence of acetone. So this is one of the drawback of Gerhardt's test, and that is why we don't perform it in the lab. Okay. By performing this test, you can only find about the presence of acetoacetic acid. Acetoacetic acid is the acidic form of acetoacetate. It's like you are the same person, but you have two names, a pet name and official name. It's the same thing only, same person with two names. So performing this test, only you can find about the presence of acetoacetic acid. You cannot. It will not show you the. It will not help you in finding the presence of acetone. It does not test positive for acetone. That is why we don't do it. But you have to learn about it as well. You can get question during your practical vivas. Okay. So this is our topic proper, Rothera's test. The principle of this test is alkaline nitroprusside reacts with the keto group of acetone and acetoacetate to create a purple color complex. This test is used to detect the presence of acetone or acetoacetate in urine. I am reading that again. The principle of this test is alkaline nitroprusside reacts with the keto group of acetone and acetoacetate to create a purple color complex. This test is used to detect the presence of acetone or acetoacetate in urine. Now another point to be noted here is beta hydroxybutyrate. That is also a ketone body, right? But it does not show positive in Rothera's test. So this is also one of the drawback of Rothera's test. But for finding the presence of beta hydroxybutyrate in urine, you have to do the advanced Rothera's test. This Rothera's test, the one that you will be performing, that will not show positive for beta hydroxybutyrate. The reason is the keto group is not present in beta hydroxybutyrate. What does the principle say? The principle of this test is alkaline nitroprusside reacts with the keto group of acetone and acetate. But beta hydroxybutyrate doesn't have the keto group. It has the hydroxyl group. That is why it does not show positive. Am I clear? I'm changing, okay? So these are the reagents that you need for performing this test. First we need ammoniums. We need the urine sample. This is the urine sample. Okay, everybody can see. Then we need ammonium sulfate crystals. Okay. Then 2% sodium nitroprusside. Okay. And at last we need liquor ammonia, not liquor ammonia, it's liquor ammonia. Okay. Now the function of these reagents, ammonium sulfate crystals, it precipitates the protein and other impurities in the sample and makes the sample clear for reaction. So now in the urine sample we can have presence of protein. Should I off the fan? Many of you are coughing. Should I off the fan? So in the urine sample there can be presence of protein or glucose or any other impurities we can have in the in the urine sample that can be present, right? So for the reaction to take place, you have to clear out the rest of the things so that these ketone bodies can react. So what ammonium sulfate crystals do is, it precipitates the proteins and other impurities in the sample and makes the sample clear for reaction. 2% sodium nitroprusside dissociates into sodium nitroferricyanide, which reacts with ketones and forms purple color ring. Like ammonia, it makes the medium alkaline for the reaction to take place. Now understand this, 2% sodium nitroprusside dissociates into sodium nitroferricyanide in an alkaline medium, and the alkaline medium is provided by liquor ammonia. Did you understand? ammonium sulfate crystals clears the urine sample for the reaction to take place. It clears out the impurities, the protein or the glucose, whatever is there in the urine, so that the reaction can occur. 2% sodium nitroprusside dissociates into sodium nitroferricyanide, which in the presence of alkaline medium provided by another reagent, that is like ammonia, makes the purple color ring. So this is the function of the 3 reagents that we use in the test. Okay, so this is the procedure. Take 5 ml of urine sample in a test tube, saturate the urine sample with ammonium sulfate crystals, add 2 drops of freshly prepared 2% sodium nitroprusside solution to it and shake it well. Then add 1 ml of liquor ammonia by the side of the test tube. Okay, now I am going to perform it in front of you. This is a test tube. This is a pipette. This is 1 ml pipette, so we'll have to take 5 times. When you will do it, you will also take 5 times. I am holding it with my hand because I don't have a holder here, but inside you will hold it with a holder only. Okay. What is the second step? Yes. You'll add a pinch of it. And then what does it say? You have to saturate, right? So you'll use this to saturate it. And how do you know it has been saturated? How can you say it has been saturated? When we will see the precipitates are here in the below, that means it has been saturated. If it is not there, that means we will have to add some more. Okay. What is the third step? So I am going to add 2 to 3 drops. Then shake it. What is the fourth step? By the side. So this is very important. This is 90 degree. This is 90 degree, right? You have to tilt it a little, like 10-15 degree, and then you add it. Slowly by the side, continuous but slowly. Do you see a purple color line? See it? So is it positive for ketone bodies? Can you guys, the people at the back, can you see? Positive for ketone bodies? Yeah? Okay, now you understood how to do it. So when you'll be going inside the lab and you'll be assigned your places, don't go to the stations and stand blank like we don't know what to do and ask your friends or us. I have performed it in front of you. Okay, now you can ask one question. When I did it, the line is thin. This purple line is thin. When some of you will do it, it will be broader than this. Why? This is because of this tilting position. If you're tilting it more, the surface area is more. So this purple color complex will be much fatter, broader than my one. It can be. So that is important. Okay, got it? Any confusion with the procedure? All clear, right? Okay. So in observation, we see a purple color ring at the junction of both the liquids. The liquids, that is the urine sample and the liquor ammonia. We'll see the purple color ring in the junction of both the liquid in observation. You saw the one that I performed between the junction, okay? inference, appearance of this purple color ring indicates presence of acetone or acetoacetate in the urine. Sodium nitroprusside reacts with ketones to form a purple color complex in alkaline medium provided by ammonia. Clear? Now to be noted, this test is very specific but not very sensitive. Who can tell me what does it mean? What does this line mean, that this test is very specific but not very sensitive? It has low sensitivity. What does this line mean? What is the meaning of specific? Particular. So this test is very specific for detection of ketone bodies only. Okay. But has low sensitivity means? Huh? Less?
False result.
False?
False result.
False result.
Like the purple link happening.
No.
The concentration should be high.
Other reaction not happening.
No.
It might be a clear solution, it gets a little bit of shake.
No. Less sensitivity means, what is the normal value of ketone bodies in urine in a healthy person? 20, right? Suppose you tested a urine sample and you saw that it came positive. There was a purple color ring. What does it mean? That it is positive for ketone bodies. But then you saw that there was no purple color ring. That means it's negative? No. This means that ketone bodies can be present but in traceable amount. So this is one of the drawbacks of this Rothera test. This is that you cannot have you cannot estimate the exact amount of proteins present in the urine sample. So this is why Rothera's test is specific but not so sensitive. Now, false positive test is possible if urine contains levodopa or phenylpyruvate. False test can be seen if the patient is consuming levodopa. It's a drug. Or if the patient has phenylpyruvate. Okay? Can I change? Okay, so this is a lab report. People at the back can see now? It's clear? So this is a lab report. I did not make this report. I have collected it. This is of a actual patient. The history is, this lady is don't talk. The patient is a lady, 60 years old. Listen to the history properly. Lady, 60 years old, and she is a known case of diabetes, hypertension, and chronic kidney disease. Okay, and she is under medical management. She does not need dialysis. She is under medicines only. So she came in the emergency with complaints of shortness of breath, SOB, and decreased urine output since last 2 to 3 days. So these are the complaints of the patient. Now, so far, whatever you have studied in the lab or whatever you have learned so far, based on that, see this report and tell me what are the things, abnormal things that you can find out. See, she is a known case of CKD, right? What is the complaint? Decreased urine output. Her normal urine output will be anyways lesser than you and me, because she is a chronic kidney disease patient. But in this case, she is having anuria. What is anuria? less than 100 ml urine in 24 hours. So could be some acute cause could be there because of which she is presenting with these complaints, right? So can you detect the cause in here? Come here, come in microscopic. Now can I tell the answer? Did you come with any
Infection.
Yeah, infection is there, yes. Since pus cells are more. And what else? Yes, infection was there. The patient had infection. She was admitted for that. What infection? Now you are doctors, your relatives will come to you with reports that this is my urine test or blood test report. Can you please explain it to me? You cannot show blank faces there. You have to say something, you cannot be alienated to it. The reason why I added this is not for doesn't have any correlation with the topic. But so that you can get little acquaintance. Whatever you are learning now has a clinical application. Don't think this is just for theory purpose. This has a clinical application. I'll tell you why. I'm telling the answer. You see, in physical examination, we have transparency and deposits what? Slightly hazy and present. Right? What is the history I gave? The patient is a chronic kidney disease patient. Are her nephrons, the kidneys working properly? No. More impurities in the urine sample. That's why slightly hazy and deposits are present. Then coming to the pH, it's 5. Normally it's 4.5 to 8. Fine. Then the specific gravity is 1.010. The normal is 1.010 to 1.030. Now what is the condition we say when the specific gravity is 1.010? Do you remember the term? Sir has taught you during specific gravity class. He mentioned about it. Do you remember? Isosthenuria. Okay, when the pH is when the specific gravity is 1.010, this is known as isosthenuria, and typically seen in CKD patient. The patient is CKD, right, as I said. So then coming down to urine glucose, it is negative. The patient is under medication, it is negative. Then urine protein is positive, 2+, means the patient is CKD patient. Her nephrons are not functioning properly. The proteins are not getting reabsorbed. These are coming out in the urine, that's why it's positive. Then urine ketones are negative, can be. Then coming down to microscopic examination, pus cells are 25 to 30, normally 0 to 5, and epithelial cells are 6 to 8, normally 0 to 4. So what are pus cells? Dead, WBCs. Why dead? Because they are fighting against an infection. As she said, they are fighting against some infection. They are doing something, that is why in the process they are dying in more quantity. That's why they are coming out with the urine, right? So there is an infection, as well as epithelial cells are more than normal because there could be some kidney injury could be there, kidney inflammation can be there, because of which the epithelial cells are getting eroded. Okay, superficial mucosal layer is getting eroded because of some infection, injury, or could be inflammation, and they're coming out with the urine. Now you understand how you have to do, and seeing the microscopic result, seeing that you will have an idea that the patient is having an infection. Infection caused by organism. Then what will you do to detect the organism? You will advise for a urine culture. Okay, then you advise for a urine culture. That's how it will click in your mind. This report is of urine REME, that is urine routine examination and microscopic examination. Okay, you understood now? Got a little idea of how to do? Okay. This patient particularly had UTI, for which her kidneys shut down. The kidneys were shut down. She was CKD. She had UTI. Then she took kidney injury. She had disease. She had. Then she took that She had two sets of dialysis. After that, she was fine. Then she got discharged. So some terminologies. Ketonemia, first don't note down, first understand. I'll give you time to note it down. Ketonemia, ketonuria and ketosis. You will come across many such things, okay, many such terminologies during your course of studying. Understand the thing first. Break the words. Ketonemia, amia, it ends with amia. Ketonuria, it ends with urea, and ketosis ends with cis. Anything that ends with amia means it is present in the blood. Anything that ends with urea means it is present in the urine, and anything that ends with cis means it is present in the system. So what happens when ketone bodies are present in the blood, it is ketonemia. Ketone bodies present in the urine, that is ketonuria, and when it is present in both blood and urine means it is present in your system, the whole body. Okay, got it now? Note it down.
Ma'am, for system, both blood and urine.
Yeah. You read this definition: the excess formation of ketone bodies resulting in ketonemia and ketonuria causes ketosis, which is seen in uncontrolled DM, prolonged starvation, and toxemia of pregnancy. Toxemia of pregnancy, it means suppose hyperemesis gravidarum, it is a condition. Okay, when a lady got pregnant, did you hear she vomits more and more in the this is toxic because of toxemia, then we call it toxemia of pregnancy. If it subsides, then it's fine, but suppose whatever she is taking, she is vomiting again and again, so she is not being able to eat anything, and this is, suppose she is not eating anything for 6 hours, 7 hours, she is not eating anything. So then it can cause toxemia of pregnancy. And in other cases you can see hyperemesis means, break the words, hyper means what? More. Emesis means vomiting. Gravidarum means what? Pregnancy. Uterus. Gravidarum means uterus. So during pregnancy, when the lady is vomiting more and more, because of which she is not being able to intake anything, so what will happen? That fat metabolism will be there for energy production, that is toxemia of pregnancy. Another thing could be a lady, she never had diabetes, but when she conceived during her gestational course, she developed diabetes or she developed hypertension, and post delivery she can get eclampsia also. Okay, these are complications of pregnancy. This toxemia of pregnancy itself is a 3-hour, 4-hour topic, which you will get to in details when you will have your obs gynae in your final year. For now, you have this much idea. Can I change? So another clinical case. Listen, I am reading it out. You can note later on. First, understand. Suppose you are posted during your internship, you are posted in emergency posting. Okay, you are the intern there, and you got a 15-year-old boy in comatose condition. He came to you in comatose condition. He is a 15-year-old boy, and he is known case of diabetes since 5 years on irregular insulin treatment. Previous year he had an episode of loss of consciousness while playing, for which he was treated with glucose and he recovered. On examination, his palm was cold and his breath was having fruity or sweet odor. Pulse rate was 120 per minute and respiration was fast and shallow. Then you advised for some lab test, and in the lab test you saw that the random blood sugar was 512, the pH of the blood was 7.05, normal blood pH ranging between 7.35 to 7.45, and in the urine test you saw that protein was absent. Ketone bodies are 4 plus, sugar is 4 plus. I'll tell you what this plus means, but for now just understand that ketone bodies are 4 plus, sugar is 4 plus. And your diagnosis was DKA, diabetic ketoacidosis. Okay? But why diabetic ketoacidosis? Who can answer? Break diabetic ketoacidosis. There are 3 words in your diagnosis. हाँ. हाँ हाँ. Acidosis.
System.
pH low, pH is low.
Yes, cis means system means the blood.
pH low.
हाँ. Yes, exactly. Diabetic ketoacidosis because the patient is having high sugar. Diabetic keto because the protein is 4+, and acidosis because the pH of the blood is 7.05. That's why it's less, so it's acidic. That's why diabetic ketoacidosis. Now, what is the normal pH of human? 7.35 to 7.45. I have mentioned this is the average value, but we say theoretically it is 7.4. For your understanding, I am saying it is 7.4, but we don't get 7.4 exactly. The pH, if we check for you, me, all of you, we check, we will not get exactly 7.4, hardly 1 or 2, but that is also doubtful. That's why we give a range for it. Now, if the patients, not this patient, suppose the pH of a patient is 7.38, what will you say? Is it acidic or alkaline? Normal. 7.38? No, it's not. It's less than 7.4, right? It's less than 7.4, then it will be acidic. But the patient, but the person will not have any complication because our body copes up in that case. You will not exactly get 7.4. For your case or my case, anyone will not have exactly 7.4. The reason why we give a range. And if it is a slight difference is there, our body will cope up in that position. If the difference is vast, in that case, symptoms might appear. Did you understand? The pH is actually 7.4, but we see it as a range, plus minus 1, 2. Okay? Any question you want to ask from here? Should I change? 4+. Oh yeah, I'll tell that in next slide. Can I change this slide? Write this. If you want, you write. I'm not forcing anybody to write. If you feel like, you write. If you don't feel like, don't write. It's up to you. If you feel like, should I change or not? Tell me. Change. Okay. So, what is dry chemistry? Who can tell me dry chemistry? What is dry chemistry? Sir has taught dry chemistry. He mentioned about dry chemistry. What is dry chemistry? Who can tell me? Yes, you. Stand up. Stand up. Yes, you. Stand up. Tell me what is dry chemistry.
No lab materials are needed. We can perform it at home anytime.
No lab materials are needed.
No lab is needed.
No lab is needed.
We
And
can perform it ourselves at home always. Just like the pregnancy sticks that we found. Those are dry chemistry.
no, but chemical is required. Chemical will be required. If you won't have chemical, how will the test come?
No lab is required.
No lab is required. Anything specific more?
Anybody can perform. No technicians are.
Home.
What do we need inside the lab to perform? Inside the lab we will need what? Chemicals, reagents, those are wet. But if we perform it at home, as she said during pregnancy, when we perform it at home, do we take chemicals and reagents? That strip is there. The chemicals are dry. That is dry chemistry. We don't need to heat it. We don't have to use any wet chemical, any wet reagent. We don't have to, right? That is dry chemistry. So urinary ketone bodies can be measured with dipstick test, and the values are expressed by 1+, 2+, 3+, 4+. As I mentioned in my earlier slide, 4+, ketone bodies were 4+, so that's how we do it. So this is dipstick. Dipstick for ketone glucose. You can dipstick for ketone, you can do it for protein also, you can do it for glucose also. The strips are color coded. Different colors are there. You dip it in the urine sample and then the color changes accordingly. So the dipstick is coated with chemicals that reacts with the ketones such as sodium nitroferricyanide and glycine. The color codes that are there in the strip, they are coated with sodium nitroferricyanide and glycine, which reacts with the urine sample when you dip, and then it gives you the result. Now seeing this nitroferricyanide, do you remember what were the three reagents? What were the three reagents for Rothera's test? Ammonium crystals, then sodium nitroprusside. Okay, sodium nitroprusside, what was the function? It dissociates into what? Nitroferricyanide, right? And what do we have here in the these strips? We already have the nitroferricyanide and glycine. Now you understand how it is happening? In the Rothera's test, the sodium nitroprusside dissociates into sodium nitroferricyanide in the presence of alkaline medium provided by liquor ammonia. But in these strips, we already have this sodium nitroferricyanide and glycine, which reacts with the urine sample when we dip it. Now, presence of ketone bodies in urine can also be due to toxemia of pregnancy and also be due to high intake of fat and low carbohydrate diet. You, madam, stand up. No, not you, behind you. Yes. Tell me why ketone bodies are more if we are having a high fatty diet. High intake of fatty diet, yeah. Why is it more? There's no point of noting down if you're not paying attention to what I'm saying. First listen to what I'm saying, then you note down. I'm giving you time to write. She's noting down so nicely that she's not hearing what I'm saying. How is ketone bodies formed? By what? Fat metabolism. So if you take more and more fatty food, what will happen? Only fat will be metabolized. So what will it form? Ketone bodies. Okay? Huh? Yes. Yes. So and why will it be more in case of low carbohydrate diet? Who does bodybuilding? Anybody who is into gym and all that? You? Anybody? Gym? Who can tell me about keto diet? What happens? Sit down. What happens in keto diet? Do you have any idea?
There's a specific time interval for the...
Yes. Who raised their hand? You do keto diet?
No, ma'am, I'm aware of the keto diet.
Okay.
Low carbohydrate.
Low carbohydrate diet. Yes. So, do you know what happens?
Yes, ma'am. Carbohydrates usually store more water weight in our body. So the purpose of keto diet is to lose the water weight.
Exactly. To decrease the mass. The athletes do it. Sit down. The athletes do it to decrease their weight before their performance and whatsoever. So what happens in keto diet is you are taking less carbs. You're taking less carbs, so what will happen? More fat will be utilized, metabolism will happen. So in that case, more ketone bodies will be formed. So that's why it is termed as keto diet. Okay, so in that case, if a person who is on a keto, listen to the question nicely. If a person is on a keto diet for last 4 months, okay, and another person started the keto diet for last 2 to 3 days, both should have ketone bodies. Should both have ketone bodies in their urine? Yes or no? No? Why no?
4 months.
He is doing from a very long time and the other one has just started, that's why it will not be effective.
Not, I didn't get it. Not be effective in whose case?
Who has started 2 days before?
And it will be effective in the person who is doing for the long time. Wrong answer. Wrong. It will not be there exactly. If you're doing it, you're right, but it's little, it should not be the way you said. Person who is doing for a long time, his body is already adjusted to it, right? His body already understood the routine, he's adjusted to it. But a person who freshly started, his body is not adapted to it. So ketone bodies will be present in the person who started it freshly. Got it? So now question answer. Some meme to lighten up the class. We don't want to be so serious and boring, do we? We don't. Okay, you can note down the questions. What is the cause of ketonuria with elevation of blood sugar? Yes, you. You do not know this. This one you don't know. But you have to learn. Stand up. Give it a try. Tell me, what is the cause of ketonuria without elevation of blood sugar? Did you understand the question? What is the cause of ketonuria? Means presence of ketone body in urine without elevation of blood sugar, without diabetes. What could be the cause? In what cases we can see ketone bodies? What are the conditions that I have said? Then in the first, when I came, I said starvation. Yes. So starvation can also be the. So sit down. So the cause of ketonuria without elevation of blood sugar could be starvation. In Rothera's test, what is the importance of ammonium sulfate? Who can tell me? Yes. The sample, it precipitates the samples so that the reaction can take place. It removes the impurities. Yes. Okay. What is the sensitivity and specificity of Rothera's test in diagnosing ketoacidosis? Yes, you. What is the sensitivity? Tell me the sensitivity. What did I say? The sensitivity of Rothera's test. Sensitive to ketone bodies.
Specific to ketone bodies. And sensitivity.
Okay, sit down. You tell me. Stand up and tell me the answer.
Rothera's test is not very sensitive.
Yes, why?
Because sometimes it can be
False positive. Did I say that? No, it's okay. I know you heard it from your friend now. Okay, now who will tell me? Yes, her. You. Tell me. Tell me what is the sensitivity and specificity of Rothera's test in diagnosing ketoacidosis? What is the sensitivity? What is specificity of Rothera's test? What does it mean? Do you know? Did you note down? When I explained, did you note down? See, only noting down will not help. You know it's good. Let others also learn. Noting down will not help. It's like a mental satisfaction. I have it with me. I have the PPT. I have noted it down. I'll go home and study later on. I'll go in the hostel and I'll study later on. That's not like this. You have to capture things in the lecture also. Sit down. You. Tell me the sensitivity and specificity of Rothera's test.
Is very highly specific, but not that sensitive.
Yes, that is the question only. That is the question I am also asking, but the answer, the explanation to it.
Because sometimes it is false test.
When did I mention false test and false negative and positive? You guys are making up and everybody is repeating the same thing. Who can answer nicely? Oh, wait. She learned it. Okay, stand up and tell. Tell confidently. Sit down. Stand up and say it nicely. Yes.
sensitive means we cannot detect exact amount of ketone bodies और specificity का मतलब we determine detect of ketone bodies.
It is only positive for ketone bodies. Specific means, what is the English meaning of specific? It is particular. Sit down. Good try. It is particular. So it is only specific for detection of ketone bodies. And sensitive, less sensitive means, what is the normal range? 20 is the normal range. If the Rothera's is negative, doesn't mean that the urine sample does not have ketone bodies. Can be there in traceable amount. Rothera's test doesn't give us a value. Okay, it just tells positive or negative. But this dipstick that I have showed, it gives you a value approximate. That also not very this one. That is why we have that plus. It gives you an approximate value. The difference between this. You can get Viva questions like this. Okay, the drawbacks and all that. How will the urine smell if ketone bodies are present in urine? Who will tell? Wait. Who will tell? Yes. Huh? It will smell due to that. Not following that means you're not following the class. So how will the urine smell if ketone bodies are present in urine? Sweet. It will smell sweet. You're not following that means. Sit down. Okay, how will the breath of the patient smell in case of decay and why? Yes, yes, you. Fruity and sweet odor. The breath of the patient will be fruity and sweet odor. Why? Particularly which one? Acetone, yes, and that is also known as good. That is sit down. That is also known as acidotic breath. When you will be in your practice, that time you will say acidotic breath, not this fruity, sweet smelling in that. What makes the medium alkaline in Rothera's test? Who can say? Yes, tell. Like a ammonia. So, the end. Hey, first step is holding it. You as well, use it. Now you take. What is the next step? Yes, do. Wait, hold it. Take some more.
Or should I do it?
No, some more. Yeah, you're taking less in quantity. Yeah. Okay. Okay, keep it. Now where is the stirrer? Not like this. Like this. Don't let it touch the bottom. Just do it in the liquid. Yeah. Yes. Enough, yeah. Okay, done. Now you have saturated the sample. Yes, now you also do it. Then after that you will add what?
2 freshly prepared 2 drops of
Sodium nitroprusside. 2 drops. One, two. Okay. 2 to 3 drops. Doesn't matter. Now shake it. Okay, done. Keep it. Now add this. What is this?
Sodium
Nitroprusside. You will add how many drops?
2 drops.
Yes. Yeah, it's okay. Now after that, what is the step? Shake it. You added this, right? Shake it. Okay, then the last step?
1 ml of
Like ammonia. Yeah, take 1 ml. How will you add? This is 90. This is 90. So you will tilt it a little. Slowly but steadily you will pour it. Okay? Slowly but steadily. Control with this hand. Nothing to worry. Take some more. You take 1 ml. Yeah, okay. Pour it. No issues. It's already appearing. It's there. Mister, can you see? Yeah, it's there. You also take it. Do you see? It's there. It's a thin one, right? Yeah. Did you take 1 ml? Yes. Now pour it. Slowly and steadily. Slowly, continuously. It happened? See the difference? The one that I did and the one you did? It's how you tilt it. It depends on the tilting. Yeah, did it appear? It's there. See? It's there. If you give some time, it will appear more clearly. Okay? Nice one. Both of you did very nicely.